Hi, in this video, I will demonstrate how to properly measure blood pressure. Blood pressure is defined as the pressure exerted by circulating blood upon the walls of blood vessels. Blood pressure is usually expressed in terms of the systolic maximum pressure over diastolic minimum pressure and is measured in millimeters of mercury. The systolic blood pressure number measures the pressure in the arteries when the heart beats. This is when the heart muscles contract. The diastolic blood pressure measures the pressure in the arteries between heartbeats, which is when the heart muscle is resting between beats and refilling with blood. Normal resting blood pressure is approximately 120 over 80 millimeters of mercury. If blood pressure readings indicate higher than 120 over 80 millimeters of mercury, this can lead to hypertension or high blood pressure. High blood pressure is a common condition in which the long-term force of the blood against the artery walls is high enough that it may eventually cause health problems such as heart disease. Therefore, maintaining or adopting a healthy lifestyle can prevent or delay the onset of high blood pressure or other health problems. In order to ensure an accurate blood pressure measurement, the client should be seated for a minimum of 5 minutes in a chair with back support, having feet on the floor with their arms supported at heart level and keeping a straight back. Also, make sure the client has a bare arm in order for you to be able to wrap the cuff firmly around the upper arm. Next, you will choose the appropriate cuff size in order to ensure accurate readings. Cuff sizes range from infant to adult. The cuff should surround at least 80% of the upper arm. A cuff size that is too small will overestimate the reading, and a cuff size that is too big will underestimate the reading. Once you have found the right cuff size, you will then wrap the cuff firmly around their upper arm, making sure you align the cuff with the brachial artery. Place the pressure dial on the cuff to keep it stabilized throughout the assessment. Make sure the air exhaust valve is turned all the way to the right prior to beginning the procedure. Using the alcohol swabs, disinfect the stethoscope prongs. Once you have done so, be sure to let them dry. Be sure to position the stethoscope prongs facing forward when putting them on. Lightly tap on the chest piece to make sure that it is on. Next, place the stethoscope chest piece below the antecubital space over the brachial artery. You want to inflate the cuff pressure between 180 to 200 millimeters of mercury. Slowly begin to release the valve to the left, releasing pressure at a rate of 2 to 5 millimeters of mercury per second. As the pressure falls, the reading when the sound of blood pulsing is first heard is recorded. This is your systolic pressure. As the air continues to be let out, the sounds will disappear. The point at which the sound stops is recorded. This is your diastolic pressure. For a final accurate measurement of blood pressure, be sure to perform this procedure 2 times with a minimum of a minute apart. Then, calculate the average of both readings. Once you have recorded the blood pressure measurements for your client, you can refer to the table to determine the client's blood pressure classification. Provide your client verbally and in writing with their specific blood pressure numbers and blood pressure goals.